One of the key concepts is word embedding. Essentially, LLMs translate words into numerical representations, kind of like a secret code that computers can understand.
So it's like taking a word like diagnosis and turning it into a string of numbers that represents its meaning.
Precisely. Each word becomes a vector, which is a set of numbers that captures its meaning and relationships to other words. Words used in simile contexts will have similar vectors, even if they don't share any letters.
That's fascinating. So heart attack and cardiac arrest would have vectors that are closer together than, say, heart attack and headache, right?
Exactly. It's this ability to understand semantic relationships that allows LLMs to do things like summarize medical reports, translate technical jargon into plain language, or even generate personalized health advice.
Okay, that makes sense. But I'm also thinking about the potential for errors or misinterpretations. Human language can be so nuanced and context-dependent. How do LLMs handle that?
That's a great question, and it gets to the heart of some of the challenges we've been discussing. LLMs don't understand language in the same way humans do. They rely on statistical patterns and probabilities, which can sometimes lead to misinterpretations, or, as we talked about earlier, hallucinations.
So even with all this sophisticated technology, there's still a risk of the AI getting things wrong, especially when dealing with the complexities of human health. That seems like a good reason to be cautious.
It is, and it highlights the need for human oversight, critical evaluation of LLM output, and continuous refinement of these systems as we learn more about their strengths and weaknesses.
We touched